Hi everyone, my name is Henry Chambers. I am studying a Masters of Clinical Exercise Physiology, and today I'm joined by Annie Radha.
And I'm studying Master of Biomedical Science, specializing in neuroscience.
Today we'll be talking about multiple sclerosis, or more commonly known as MS, and how aerobic training can be used to benefit those with MS. This will help provide some recommendations for future research and in a clinical setting for a variety of health professionals. But Anuraha, can you give us a bit of a background on what MS actually is?
Be my pleasure. Multiple sclerosis. The term means multiple scars and affects around 2.8 million people worldwide. It is a progressive inflammatory condition causing neurodegeneration of the central nervous system. It affects a huge age range, like from 20-year-olds to 50-year-olds.
Wow. And why does MS occur, or why does it happen?
Well, the exact etiology is still unknown, but the accumulation of inflammatory cells, specifically the autoreactive lymphocytes that traverse the blood-brain barrier, eventually form lesions that causes gliotic scarring, axonal loss, and demyelinating plaques. So the damage to myelin sheath interrupts the flow of nerve impulses in CNS that keeps our muscles functioning, resulting in muscle weakness. It is still not clear why this autoimmunity occurs, but speculations say maybe due to combination of genetic and environmental factors.
Really interesting. You talked about muscle weakness. Can you please expand on some of the other symptoms that might occur for people with MS?
Well, symptoms are vast, starting from spasms, fatigue, loss of power in the limbs, and spanning to sexual dysfunction, loss of vision, depression, and complete inability of movement. Based on clinical characteristics, there are few forms of MS, one of which is RRMS, relapsing remitting MS, where symptoms come and go and often resolve itself. On the other hand, in secondary progressive MS, the degeneration is much quicker. It is interesting to note that women are more susceptible to this and show greater range of symptoms. Henceforth, the symptoms, there's no specification to that.
And are there any treatments or therapies that are being used at the moment for those with MS?
Currently, there are no cures for MS, but medications are used to help control symptoms, modify the course of disease, and manage pain. Immunosuppressives and anti inflammatory drugs are the most commonly prescribed. The treatment is very individual based, and for patients with primary progressive MS, most treatments haven't shown any improvement. Steroid and chemotherapy are also used in some cases. Psychological counseling and physical therapy is a recommendation throughout. So, Henry, could you enlighten us about physical therapies?
Absolutely. There are a range of physical therapies, and particularly I'm going to be focusing on exercise and physical activity. Specifically, in that is aerobic training. Now, aerobic training is a mode of exercise that is generally repetitive in structure and uses aerobic metabolism to create ATP as the primary energy pathway for this training. It's mostly known for its improvements in cardiovascular systems. However, there are improvements in fatigue, muscular strength, balance, mental health, and self reported quality of life in people. Specifically for MS, patients can have a multiple sclerosis quality of life 54 questionnaire. And we're going to bring that up in some of the research we'll talk about.
That is fascinating. But how many people with MS are actually participating in physical activity?
To give you a brief overview, in Australia, in 2022, a study was conducted that had 1,260 respondents to a questionnaire, and it showed that 24% of the individuals in this study did not participate in regular physical activity. They were all diagnosed with MS, and this can be due to a range of factors such as functional ability, fatigue, and depression.
Understandable, as obesity increases one's susceptibility to MS, along with smoking and many other things. So, Henry, what are the benefits of aerobic training?
There are lots of benefits to aerobic training, particularly the variety of aerobic training. there's multiple different modes that we can use, such as treadmill training, running or walking. We can also use cycling. We can also use aquatic exercise, just to name a few. So for those who have limited access to things, we can certainly get around those barriers by using different modes. And as well, we can use it in patient preference. Additionally, there's been shown in an 8-week study with looking at aerobic exercise and yoga training on depression and quality of life that there were significant improvements in bodily pain, fatigue, social function, and also differences in the MS Quality of Life 54 questionnaire I mentioned. As well, in a 12-week, 30-minute, 3 times per week treadmill training study, it was shown that there was a quality of life change in that same questionnaire, but also there are improvements in walking speed and body weight support, which may suggest that longer interventions could even show better outcomes.
That's wonderful, but could there be any detrimental effects?
For sure. And there are two mainly that I want to touch on. The first one being is we have to be considerate of the patient. As you highlighted earlier, the symptomology can vary day to day. So we need to understand and prescribe exercise that's going to be individual preference and to their symptoms. As well, we need to be looking at how the limiting factors can be a problem, such as access to certain facilities or equipment like a treadmill or a pool. And for some people, that's just not feasible to have access to. So we need to be working around those barriers.
So, where do you recommend the research leans toward?
I recommend that it leans towards 3 different areas. So the first one being that a lot of the studies that we looked at and also have been used so far have looked at acute effects of exercise. So in that 8 to 12 week period, where no longer term studies or little longer term studies have been conducted, this might show higher improvements and long term benefits of aerobic exercise. Additionally, a variety in the disability levels and the control group parameters throughout studies may be limiting the validity of the outcomes with aerobic training. And lastly, we want to understand the mechanisms behind why aerobic training is so beneficial. It's been speculated that potential increases in brain-derived neurotrophic factor, BDNF, and new nerve growth factor, NGF, have been shown in different studies. And this could potentially be linked to physical fitness improvements, reductions in fatigue, and changes in quality of life. But we just aren't sure at the moment. So that's where I would recommend the research goes. And Raha, do you have any areas that the research should be leaning towards?
Um, the studies have shown that MS is more prevalent in white population, yet there is a faster deterioration in African and Hispanic people. So maybe population-based studies on collaboration between pharmacological interventions, physical and psychological therapy for enhancement of quality of life could be beneficial to look at. Also, studying intracellular signaling during aerobic training could potentially provide mood management and motor function control improvement results. Well, finally, what would you recommend for as exercise to MS patients?
I would recommend for health professionals working with MS patients that the main goal should be client-centered approach. So looking at the preferences of exercise for those with MS and also having a collaborative approach to understand their symptomology so that their prescription can be tailored towards them is going to be extremely crucial in improving the quality of life and also their physical function. However, some rough guidelines for health professionals are that we're exercising 2 to 3 times per week with aerobic training. We have 30 to 45 minutes in those sessions, and the intensity of those sessions is 45 to 75% of heart rate max over an 8 to 12 week period. Thank you for listening to our podcast. We hope you enjoyed it.